As you heard from me yesterday morning with the introduction of Harmony, this is a vision I've had personally for the company effectively since conception, which was really, it was stemmed from my experience as a patient with just getting over-communicated, not knowing who to reach, and I wanted to create a system and an open platform so that all these different technologies and people could communicate through one set of pipes. And so that was, it took a long time to actually bring that to life in a slide, but that was the inspiration behind Harmony. And Dan Dodson, and we've heard from UNC a little bit over the last day and a half, Dan has actually been one of the early adopters or innovators around that concept. And you've looked at your portfolio and you've seen all these opportunities for consolidation, at least of the communication pathway, and you've done some really interesting work. So my goal today is to expose all of you to some of that thinking. Hopefully you can come away with ideas on how you can bring some of that thinking to your own organization and hopefully apply Harmony. I know there's been a lot of interest in the beta, okay, let me set the stage on our partnership with UNC, your great organization. We started working together almost 2 years ago, so June 2020.
Yes, when we launched, yeah.
And I think the initial use cases, if my Post-it has it right, scheduling, broadcast campaign. So if we go back to that race car analogy from yesterday, phase one was some of the kind of basic functionality of the platform.
Sure.
And then over time, we've added in conversational, referrals, recalls, Optime integration, self-service analytics, chat assist you've been an early user of. But what we want to talk about today is integration. Yes. So you had the idea, and I don't know how long ago this was, around an integration with a specific use case around wayfinding. So can you tell me more about that idea and the integration and how it came to be?
Sure. So we have a couple of partners within our digital ecosystem, as all you have as well. You have multiple vendors, and we have a lot of big platforms. And we had two major platforms. One is a company called Gozio, who does our mobile digital front door. I know Pam doesn't like that term from yesterday, but that's what we started to call it. And we were really looking at not only how we expand the existing platform. So when we work with Artera, as Guy just mentioned, we try to take full advantage of all the different features. But we also try to look outside of that ecosystem. And how do you combine these two experiences so that from a patient perspective, there's a continuity, and there's sort of that seamless where they don't realize you're moving from one system to another. And we just had two great partners. We came up with the idea of hey, how could we marry these two experiences up, and sort of brought it together and implemented it. We launched the Gozio wayfinding and had that about a year. And then when we launched with Artera, we sort of incorporated this new feature. And so
let's talk about the use case so that folks understand. So if you tell us more about the use case around the integration and then some of the results you saw.
Sure. So it's so one of the things we were really looking at is having our patients have a great sort of call to action. We launched right as you guys, many have done, right in the middle of COVID, at the early part of COVID. And so we had this whole big marketing plan. We were going to do this big rollout. And then all the oxygen got sucked out of the room and everything was about COVID. And so how we incorporated this is on the appointment reminder, when the patient confirmed that, there was just a link that would take us to this UNC mobile app. And it was a smart link, so it would take you to the appropriate app store. If you had the app already downloaded on your phone, it would open that up. And so it just was an easy way for our patients to be able to get access to the wayfinding and MyChart and schedule visits and things like that. And so, as I had mentioned, we had a year's worth of history, and we were doing very well. I mean, we were happy with the growth rate. But once we've implemented that with the Artera and really gave the patient that call to action at the appropriate time, we saw a 443% increase in our daily downloads. It was that proverbial hockey stick. It was going along, and then it just took off.
What if we didn't spend $1 million on billboards and added a step to the chat assist workflow, right?
Exactly.
Going back to Duncan's analogy. Fantastic. I think a lot of folks coming out of yesterday, I've heard this question a couple times, are wondering to themselves, geez, I've got a portfolio of 10, 11 vendors. Right. How do I make this happen, right? Gozio, we hadn't worked with Gozio before.
Right.
You're effectively playing the matchmaker at this point.
Right.
We don't have Zach, we don't have Harmony, you know.
Yeah.
It was very nice of you to have
Yeah.
for our theses to come together, but
Yeah.
how was that process? How did you tactically do that, and
Yeah.
trying to trigger the audience's imagination in terms of how you might do it with your own portfolio of solutions?
Yeah, I mean, you know, it just happened to, that we managed these platforms. We knew the partners. It was very collaborative. There was no really competition. You know, this isn't two platforms that were sort of in the same space. So it was really fairly straightforward. I mean, there was some technical. Eric, who's out there somewhere, really helped sort of coordinate that on the Artera side. But it was just really a great example of bringing two partners together, having them work for a greater good, and just really when it first came out. But this is really more incremental innovation, and that's really where we saw the biggest impact. It was really surprising that something that felt very straightforward got that much traction and that much press and awareness. So we pulled it together. It was the three-way conversation between UNC, Artera, and Gozio. And strangely enough, well, not strangely, but you know, as we put together this use case and implemented it and saw the results, last summer we had a lot of great press on this, but we actually submitted this in for the CIO 100 Innovation Awards, and we thought, like, hey, why not throw that out there? And we actually won, and we were one of only 4 or 5 healthcare systems to win that. And it just sort of showed to me that you don't have to always swing for the fences, right? You know, sometimes it's just doing the next logical step, adding value to the patient, making it easier for them, and that's really what drives the true value.
And as I recall, from a process standpoint, like, there was no new contracting, like the lawyers weren't involved, it was connecting technical teams, that was it, right?
Yeah, and you know, it was just one great example of using an existing distribution channel and just adding additional content at the right time. And so, you know, and I know you work with a lot of different partners, so when you think about a billing or you think about any patient experience or any of those types of things, you can just use that as that channel.
An experience I enjoyed with you is that we talked about validation yesterday in our playbook for how we, you know, validate ideas and test them out. So Dan was actually an early validation partner. So I put Harmony in front of him, these fake screenshots, and I said, Dan, what do you think? Dan was actually really honest. He didn't tell me all my ideas were great. They're not my ideas, the team's ideas,
Most
right?
of them were.
One of the things you said during validation, which really resonated with me, was kind of this, I don't need to invent everything here. Can you tell me more about that and what that means at UNC?
Yeah, so I view UNC, we are great integrators and partners. And so we're not really builders. We don't have a staff of 50 developers who, if we come up with an idea, we'll go out and build it. We work on so many different things that we can't really focus and build a team for everything, or we'd have a 200-person staff, and as we all know, it's really hard to get resources. So we lean on partners like Artera to really be those experts in that space.
Right, thank you so much. You've been a great partner. The Gozio integration it's a good playbook for the hundreds of integrations that we'll support over the next year.